Okay, good morning. My name is Larry Williams, and I'm the Veterans Outreach Program Manager here at the Louisiana Department of Veterans Affairs. And I want to thank each of you for attending the Louisiana Women Veterans Healthcare Symposium. I have to tell you, we're truly appreciative of each and every one of you that have decided to join us this morning. And, I really have to thank my panelists, which I'll get into a little later. But ladies, thank you so much for participating. And I'm definitely looking forward to all of the useful information that you have for us, and we really appreciate it. And with that being said, I will now turn it over to the Deputy Secretary of the Louisiana Department of Veterans Affairs, Ms. Julie Baxter-Payer.
Thank you so much, Larry, and thank you very much for organizing this, getting the word out. I'm so honored to be here today, and I want to welcome everyone to the Louisiana Women Veterans Healthcare Symposium. We're really excited to do this. We hope to do more of these, and we're so
Okay, did we lose Julie?
277,000 veterans and their families that we serve, and I know these wonderful panelists serve also. Of those, we understand from the federal VA that nearly 30,000 are women veterans, and we just want to make sure that we're providing everything that they need on return from their service. According to a USDVA Women Veterans Report in 2015, women made up 9.4% of the total veteran population. By 2043, it's projected to be 16.3% of all veterans in the United States. We are very proud at Louisiana Department of Veterans Affairs. We have an administrator and a director of nursing at our Monroe Veterans Home that are veterans who are leading our veterans there. And we're just so thankful for that service. We know, of course, if we look at history, that women have been a part formally of the United States Armed Forces since the inception of that Army Nurse Corps in 1901. And then in World War I, there was more than 23,000 women who served as nurses and medical professionals. By World War II, the roles of military women had expanded. And while many were still nurses, we had postal clerks and teletype operators that were coming in. But of course, fast forward to the early 1990s, when many of us were coming out into the professional world, more than 40,000 women deployed in support of the Persian Gulf War. And of course, since the tragic events of September 11th, 2001, women have greatly contributed to both Operation Enduring Freedom and Operation Iraqi Freedom. So with this history, it's just very clear to us, and I know I don't have to remind anyone on the call here that these brave women really paved the way for many generations to come, and it's a privilege for us to serve them when they come home. Today, I just want to quickly thank the representatives here today from the Women Veterans Program Managers from the Federal VA Medical Centers. This includes Southeast Louisiana Veterans Healthcare System, Overton Brooks VA Medical Center in Shreveport, and Alexandria Veteran Affairs Healthcare System. And I really want to thank those three VA medical centers. As of March 24th of this week, they have helped distribute more than 73,000 doses of the COVID-19 vaccinations, protecting those veterans and their families. That's the number of doses. And I know we're on calls sometimes daily, at least weekly, with our governor's Office of Homeland Security and Emergency Preparedness, talking about the vaccinations that are taking place across our facilities and through the efforts of Governor John Bell Edwards, who certainly sends his greetings here today as well. But I just really want to thank, he's so grateful for the VA medical centers and what you're doing to help protect veterans by getting those vaccinations out. Here at the Louisiana Department of Veterans Affairs, we care for more than 500 veterans in our 5 veteran homes. And so we know how important that protection is right now. We just want to express our gratitude to you, women who serve there at those 3 VA medical centers. Also, our advocates that will be speaking today and the women veteran representatives here as well. I just want to thank you truly. We want to support your support of veterans in each of your communities. We want to make sure that as many of our 30,000 women veterans around the state and all of our 277,000 veterans and their families know best how to support and truly to honor our women veterans. So thank you again for being here today. I'm looking forward to the symposium, and I'll toss it back to Larry to get started. Thank you very much, Larry.
Julie, thank you so much. We truly appreciate it. And especially your efforts as well. Serving as the Deputy Secretary here at the Louisiana Department of Veterans Affairs, I can say that Julie truly cares about veterans, and she does everything that she can to promote the initiatives and the programs that we have here at the department, and her leadership is really unparalleled. And I want to thank you so much, Julie, for being a part of this. We really appreciate it. So our purpose here today is to ensure that our Louisiana women veterans and supporters are aware of and receive care if required. A lot of sacrifices have been made by this special group of veterans, but it was accompanied oftentimes with immense physical and mental tolls. So this symposium will serve to provide information on the Department of Veterans Affairs, comprehensive healthcare locations, enrollment assistance into VA healthcare, and also our current care programs that are out there. We want to highlight women veteran support groups as well across the state of Louisiana, because it is so important that our women veterans and those who support women veterans know about the groups that are actually out there who do the same thing. So before I get into the presentation of speakers, we'll go ahead and clear up a couple admin notes. So if you have a question, please post a question in the Q&A box. We have two people, Stephanie and also Courtney, I saw Courtney already answer the question, monitoring the Q&A box. So if you have a question, please type it into the Q&A box. The chat box can be used for posting your contact information or your organization's contact information. If you hear something during the symposium and you say, hey, I know of a group, or even if you work in the capacity of serving women veterans or supporting women veterans, and you may want to post your information in the chat, please feel free to do so. We will answer all questions before the symposium is over. Also, this symposium will be uploaded to the Louisiana Department of Veterans Affairs YouTube page. So everyone that signed up for the symposium will receive a link to our YouTube page where this symposium will be uploaded for later viewing. Also, you will receive in an email a very, very in-depth presentation of groups that support women veterans, not only in the state of Louisiana, but also nationally, that Tanja was nice enough to put together for us. So after this, you will receive an email with a lot of great information. And I see Maisha is already posted in the chat. Thank you, Maisha. We really appreciate it. Anybody else? Because let me tell you this, I looked at the attendees, and you have people from all over the state that work in different capacities that serve not only women veterans, but veterans in general. And it's too many to name all of you, but I really appreciate you all for attending today. Thank you so much. And now with that, I'll go into the introduction of speakers. And again, thank you so much for our speakers for being here today. And I'll start with Stephanie Perry. She's a physician's assistant, also the Women Veterans Program Manager at the Southeast Louisiana Veterans Healthcare System. Courtney Fitzgerald is a licensed clinical social worker and also the Women Veterans Program Manager at Overton Brooks VA Medical Center. Tanya Whitney is a U.S. Army Master Sergeant retired. She's also the state ambassador for the Military Women's Memorial out of DC, and she is a 2019 Center for Women Veterans Trailblazer. And Nicole Weiss is a licensed clinical social worker and certified case manager. She is the Transition Care Management Case Manager out at Overton Brooks VA Medical Center. Unfortunately, Tanja Miles, who's a certified peer support specialist, won't be able to join us this morning. She had a medical emergency last night, but I heard from her and she assured me that everything is fine. She has a follow-up appointment this morning, but she won't be able to join us. But I really appreciate what Tanja does for women veterans in the state of Louisiana and also nationally. With that, we have LaShondra Dixon, who's a licensed clinical social worker and board-approved clinical supervisor. She is the Women Veterans Program Manager out at the Alexandria Veteran Affairs Healthcare System, and not with us now because she is so busy, but she will be with us later. Felicia Vance, who holds a Master of Social Work degree, and she's the lead Veteran Experience Officer at the Southeast Louisiana Veterans Healthcare System. Listen, we are jam-packed with knowledge during this symposium. I can't tell you, just reading it is, that's probably like 100 years of school and experience and all that good stuff. So ladies, thank you so much. I really appreciate it. And with that, we will go ahead and I will let Stephanie take it from here.
Thank you. Thank you. Good morning. And I'm excited to be here also. As Larry said, I'm a physician assistant, and I have spent my entire career taking care of women and children. I tell everyone up front, I'm less than 2 years at the VA, but I am the proud daughter of a veteran, and I am very excited to have been able to come aboard the VA here in New Orleans, and particularly work with women veterans, as I have really spent my entire career as a physician assistant in women's health. And so really my goal here in New Orleans, I should say our goal as the Women Veteran Program, is to really make sure that all of our women veterans receive the care that they deserve and really, quite frankly, have earned. And so you heard that women are the fastest growing population of veterans entering into our care, and I wanted to let everyone know that VHA has noticed, and we are working very hard to make sure that the facilities, the medical centers, the clinics have everything really that the women veteran could need to assist them in their health care. I like to talk about New Orleans a little bit. Just we have a lovely women's health clinic that is separate from primary care. We are fortunate to be in a new building, and we have that luxury that we were able to create that space. So we are able to provide that comprehensive care for women veterans, including we have we have 2 gynecologists on staff. Our primary care providers are women's health designated, which is something that is across the nation. We all have primary care providers that have additional and specialized training in women's health. And I think it's really just really, really important, and glad to see. Kind of as an outsider coming into the VA, there is so many exciting things going on to improve healthcare for women. And quite frankly, I'm just really, really proud to be part of it. So I just wanted to share with you today, Larry, I don't mind, do you mind going back one? And I can show you the picture of our new facility. I think it's our, yeah. This is our new facility, and it is really quite beautiful and amazing. It's windows everywhere. It's bright. It really does feel like a place where we want to be as employees and as patients. It's really great. And I love our wall in the front there that says the price of freedom can be seen within these walls. And it really is a very nice facility, not just by looking. I also believe the people that work here all across the facility really have the best interest of veterans at heart. We really are here to serve. So the next slide, you'll see our contact information. And Dr. Brewer is our medical director, and I'm the program manager. And I'm glad to hear that this will be shared and recorded so that you'll have easy access back to it. We are also fortunate to have 2 other administrative staff They're on the next slide. Nurse Weber is our nurse navigator, and she also has many years in women's health cares, where she has spent most of her nursing career in women's health, and she helps us navigate a lot of our care coordination, maternity care, mammograms and pap smears, all part of the comprehensive health care that we offer. And she's always happy to take calls and emails and answer questions, as all of us are. And also have Miss Colin, who's our administrative assistant, and she's currently out of the office, but we anticipate her back in just a few weeks. And she's extremely helpful and knowledgeable, and we're just happy to help serve. And I wanted to let everyone know we have several clinics that we also provide women's health care providers, and those clinics are listed on the next slide. And we have clinics in Baton Rouge, Hammond, Slidell, Bogalusa, Houma, and Franklin. And so our part here down in Southeast Louisiana, we have you covered. If you have any healthcare needs, we are here to assist. And so thank you. I'll turn it back to Larry.
Stephanie, thank you so much.
Yes.
We really appreciate everything that you all do. Very important work. And we can't tell you enough. Now, that facility is a beautiful facility. It really is. And I'm quite sure that, there's a lot of great care that is given down there. And also, I want to thank you for posting the other locations as well, the outpatient clinics, because, it is great to know the location of where you can go to receive care. I really appreciate it. And with that, I will turn it over to Courtney.
Hi, everybody. Thanks so much for taking time out to join us today. And thank you, Larry, for the opportunity to be a part of this. It's just so nice to be able to talk with female veterans and have these opportunities for female veteran symposiums and healthcare informational seminars. We've hosted a couple up in Shreveport, and certainly we'll continue to do that. We haven't recorded them, so each time I do one of these, I'm learning new and better ways to get information to people, since we're not able to do it in a face-to-face manner just yet. But I look forward when we're able to do that again. So I am an Air Force veteran. My background is in mental health. I work up at the Shreveport VA. We have Northwest Louisiana, Arkansas, and part of East Texas as our catchment. And so if you're up in that area and you need help or assistance, or just have questions about what services are available, I'll upload a little document that I made that covers a little bit of the services that are available through our VA. In addition to that, I want to just highlight one of the things that Stephanie touched on, how the VA is rapidly expanding services for our women veterans. And because we are the largest growing group of veterans, we're doing our best to improve not only the quality of care, but the services that are available to you. And Shreveport specifically is doing that by having this brand new standalone facility, women's clinic, that will be opening in May. And I'll share that opening ceremony information with Larry. And obviously it'll be on our Facebook page when it happens. If you're in the area, please come out and join us for an open house and a ribbon cutting. And if you need anything from myself, please don't hesitate to reach out. The best way to get a hold of me is via email. And you can always call the 800 number. I'll put that information in the chat. So thank you. We look forward to hearing from the other panelists and answering any questions we might get from the audience. Thanks, Larry.
Yeah, Courtney, listen, thank you. We definitely appreciate the handout that you will send us, and also the hard work that you do. It is truly appreciated. And listen, Courtney mentioned the questions. Just a reminder, if you do have a question, please feel free to post it in the Q&A, and we will most certainly get your question answered. And with that, I will turn it over to Tanja.
Good morning, everyone. As Larry mentioned, I am the state ambassador for the Military Women's Memorial. Many of you may know that as Women in Military Service to America Memorial. They just rebranded this year to make it a little less of a tongue twister. But what I'm going to talk about today is to kind of caveat off of what Stephanie and Courtney had said, you know, about us being the largest growing group of veterans that are coming on board. And so basically, you know, to make everyone understand, especially there are many women who still do not identify as veterans. And we are veterans, and we need to tell our stories. And then the resources that are available to women veterans, and as Larry mentioned, he will post those offline, because believe it or not, there are very, very many groups of organizations out there to help support not only all veterans, but specifically women veterans. And many of these, most of these have been started by women veterans who could not find the help that they needed when they needed it. So Larry, if you could go to the next one. Okay, just real quick, you know, there isn't an official definition of a veteran that's, you know, put out. But basically, you know, I think all of us who have served, regardless if we've served on active duty, in the Guard and reserves, you know, we all consider ourselves veterans. The legal definition comes in because of the requirements for getting into the VA, benefits for veterans, you know, as we pass on and such. So again, as I mentioned, many women don't identify as veterans, and that's, you're missing out on a lot of benefits. One of the biggest problems we have is currently in society, you know, once we are out, it's difficult for the community to recognize us as veterans. Men tend to wear, you know, t-shirts or hats that, you know, identify their veteran status, whereas women don't. So we need to make sure that we're identifying, because the problem is going to come in is, yes, the VA and the federal government and many organizations are starting to recognize women as the fastest growing group of veterans. But if we don't identify as veterans and we don't take advantage of the benefits that are being offered and register for the VA, even if we don't think, you know, we have any needs, say for disability purposes, we'll lose those benefits, because money goes where the numbers are. And, you know, and so it's incumbent upon ourselves to make sure that we push for legislation, transition into still, you know, civilian life, to approach the community that women are veterans, and our actual you know, needs are much different than those of our male counterparts. So next slide, Larry. As it said, the only way to change the world is to be part of the change. You know, many of us, I myself, was not diagnosed as suffering from PTSD until 2 years after I got out of the military, because I didn't exhibit the normal, what at that time was considered the normal, you know, experience of those suffering from PTSD. I did not abuse drugs. I didn't abuse alcohol. And through this whole process, um, it has been identified that the, um, the women do not exhibit the same results or same symptoms of having post-traumatic stress as males do. So again, one of those things that, you know, if we don't advocate for ourselves, we have a tendency to lose out. So we need to make sure that we continue to keep those uh, processes in place. And the way to do that is to get involved with your community. Even if you're not comfortable with, say, going to the local American Legion or VFW or any of those formal groups. And I will tell you, a lot of those groups are changing. They're recognizing the need to bring in women veterans into their organizations. But you know, I'm in a small town, and yeah, there's still some diehards that, you know, think I should be in the auxiliary and not in the actual Legion. So it's slowly changing, but it's getting there. One of the other things you can look at is there are quite a few areas where women have banded together and created their own American Legion post, you know, or have pushed their way, I guess, with, you know, for lack of a better term, into, you know, these organizations and are affecting the change. So, you know, there are ways of keeping those bands of camaraderie with your fellow veterans. You know, and again, one of the other things is volunteering. You know, there's through standard community service programs. You know, it doesn't even have to be veteran oriented. You know, get involved with the community, and as you get involved, your story is going to come out. Next slide, Larry. Again, as we mentioned, you know, local groups, there are a lot of local organizations out there that love to have veterans volunteer to assist, because typically, you know, people who've been in the military, you only have to tell us how to do something once or what needs to be done, and we find a way to do it. It also gives you the opportunity to get back into your community. You know, and as I said earlier, as you're in this community, people are going to ask you, you know, about your life and one of your life experiences, and that's going to be your military. And so, you know, there's ways to be proactive in the community, not necessarily with a veterans group, but that will maybe lead you to other veterans in your area for the support that maybe you need. There are support, as I said earlier, support programs, organizations, locally and nationally, that are out there for you. But you as an individual need to be a little proactive in finding those, educating yourself about the different groups. You know, and one of the biggest things with, I think, some veterans, unfortunately, you know, some look for a handout. I would encourage you to look for a hand up. And, you know, the difference is vastly greater, that you will find help for a hand up rather than a handout. So, there are some organizations that do require you to have a VA disability rating or verification. So if you are not registered with the VA, I encourage you to do that so that you can have access to those groups also. Larry? tell your story. We all have our stories. You know, I've talked with, you know, particularly women veterans who, well, I'm not a veteran because I wasn't in combat. Nowhere's in the legal definition of being a veteran does it say you had to have served in combat. You know, some will say, well, I only served 2 years. It doesn't matter. No matter where you served, how long you served, you know, what you served as, be it a secretary, a mechanic, or a pilot, or a doctor, you know, whatever. You have a story to tell, and your story is part not only of our history as women, but our history as a nation. You know, if we don't tell our stories, the world will continue to reflect on the stories that are told by others. And many of these, you know, outdated assumptions, misguided questions, you know, come about because of those fallacies. You know, even today, 70 some odd years after World War II ended, many women in the military are still fighting the opinion that was brought out during World War II that the only women who joined the military are looking for a husband or homosexuals. So, you know, 70 years, we're still fighting that. And that is so far removed from the truth, you know. So the only way we can continue to change those opinions is to tell our stories. And yeah, you may have had a bad experience in the military, but that story needs to be told also. You know, we are the strength of not only promoting our history, but the history of women in this country. And so if we don't respect our service, nobody else is going to either. So make sure that your story is told, and you can do that in a number of ways. Primarily is through the Military Women's Memorial. You can go on, they've instituted a new database. You can go online now and input everything there online. It's easy. There is no cost. I know a lot of that went back to when they originally were establishing the memorial. They asked for a donation when you registered. That is not a requirement. You can register your story for free. And, you know, what we don't record, we lose. And I have, in the last few weeks, been processing a lot of stories of women, particularly those who served as nurses in World War I, into the database. And I tell you, there's a lot of stories out there that you would be amazed to learn what these women did and what they went through. And basically, how much of their story has been lost because I'm only recovering what was maybe put in newspapers or what someone else, you know, told about them. So we need to tell our story. Next slide, Larry. And again, this is, like I said, the Military Women's Memorial Veterans History Project out of the Library of Congress is another place. There's also local colleges, states, venues that are also trying to capture the, there's a university in Texas and it's escaping my mind right now, but they have a large database of military women, particularly those who served in the WASP and the Women's Air Service Pilots Corps. University of North Carolina has a large military women's historical database also. Next slide, Larry. And again, questions, if you have any, please put them in the chat. And I thank you for your time. And again, tell your story and make sure that you are not lost, you know, in history. Thank you.
Man, Tanja, thank you so much. you know, your words are so powerful. And, you know, part of this symposium is about talking about the benefits that are out there for women veterans, also the healthcare options that are out there. But the other part of it was Tanya's presentation, you know, the side that says, yes, these are the struggles that we face, but we have to tell our story and we have to be proactive. And you know, it's just, and her work speaks for herself. It's not just her talking. She's a retired master sergeant out of the United States Army. She's also, again, the state ambassador for the Military Women's Memorial out of DC, and she's also the 2019 Center for Women Veterans Trailblazer, which was the first of its kind in 2019. And she was one of, I think, two trailblazers at the time, because Tanja was the other for the state of Louisiana. Is that correct?
That is correct. And I failed to mention, I had it in my side notes, Larry, that Louisiana is also the proud recipient of a 2021 Center for Women Trailblazer acknowledgement, and that is Miss Sandra Franks out of the Shreveport-Bossier area. So Louisiana is batting 3 trailblazers out of the 2 classes.
That is, yeah, absolutely awesome news. And Lashandra, yeah, I completely agree. You know, a lot of times when we think about groups, we think about American Legion, VFW, and you know, it's kind of a stigmatism with some of our VSOs, our veteran service organizations. But here's the thing: Tanya mentioned it. Things are starting to really evolve with our service organizations, and I would encourage anybody to join a VFW, join an American Legion, join an AMVET, because there's so much opportunity that's there. You know, these are veterans who came before us, and you know, they have out in the community doing great things. So, you know, forget the stigmatism. Don't worry about that. Go out there and make the change, be the change that you want to see. But I have to tell you, I fully support VFWs, American Legions, AMVETs, all of our VSOs. And listen, I want to pivot here because I want Tanya to please finish talking about support groups. And I'm gonna pull up this slide, um, the resource slide. And Tanya, I know we may not have a whole lot of time to go through each slide, but as I flip through these slides, can you briefly talk to us about what we're looking at in these slides? And everybody that's a part of this symposium that registered will get a copy of this slideshow.
Sure, Larry. As I mentioned earlier, these are so, and there are probably more out there, but these are the ones that I am familiar with and I know are out there doing, you know, work. The national programs organizations, again, start with the, you know, Department of Veterans Affairs, Women Veterans Connect, Service Women's Action, Women Veterans Alliance. That is a real big one right now. Again, these are national programs. They all have websites. You can get on there and you know, see if there's something there for you, or they can help, you know, maybe give you some idea of where you need to go. And again, almost every one of these, I think with the exception of 1 or 2, have been started by women veterans who were unable to find the help they needed. These are some local veteran organizations. And again, these are ones that are incorporated under 501c. There are quite a few local organizations out there that are not formally organized. They are available there. So, you know, check in your communities. There's probably one there. And then again, the you know, the national based organizations, as we mentioned, the Legion, VFW. You know, if you're a veteran of a certain type, there's probably you know, a group out there for you. So again, these are just some of those that are there. These are community, they provide community service. You know, again, some of the locals, different things that they provide. And then if you know, the big thing now is, you know, with the PTSD therapy and just, you know, in general, just to connect with other, you know, veterans out there. These are some of the programs that are out there for writing, art, music, and just, you know, like as I said, just, you know, getting together as a group of veterans. And a lot of these now are again doing Zoom. For instance, Warrior Writers meets at least once a month via Zoom. Before that, they were meeting in person, but they were kind of limited to local areas. Like here in Louisiana, they were meeting in New Orleans, but now with the Zoom, we're actually meeting, and we have, you know, people getting together from across the country, you know, and in some cases across the world. There was, you know, so Zoom is bad, but Zoom has been good also. You know, this enforced stay at home, but it's also opened up the opportunities for other things. So again, like I said, you know, get out there and look. There's probably something out there for you. So as Larry said, these will be available. They are by far not the only ones. So, you know, please make sure that you do your homework to figure out which one might work best for you. And I mean, even if you don't know, try it. Try one. You know, it doesn't hurt to go to a group, you know, spend a little time with them and determine if it's going to work out for you or not. You know, I've been in groups that didn't work out, and, you know, no hard feelings. They do their thing, and then, you know, I'll find somebody, you know, maybe another group out there. So there is a group for everyone. You just need to do a little work to find your little niche.
Tanya, thank you so much. I really appreciate it. Yeah, we kind of went off script with that one, but I thought it was very important. A couple of questions that was put in the chat. One was from Siobhan, who is the director of Upward Bound. They do great work. She wanted me to put the third slide back up. Siobhan, if you can, in the interest of time, I'm not sure which slide you actually wanted to see, but if you send me an email, I can go ahead and send you the slideshow or the deck directly. Again, this deck will be going out once we post this symposium to YouTube. You'll get a link, and you'll also get that deck that was just put up. Also, are these groups broken down per city in the state? We can help in the Baton Rouge area. So listen, some of these groups are in the state of Louisiana. Not all of them are in the city of Baton Rouge. So you have to do a little homework. In the interest of time and also aesthetics, we didn't put exactly where each group was located, but if it's local, it's in the state of Louisiana. Other than that, it is a national group, but there are so many, and you don't have to be a veteran. You can be a veteran supporter to actually support these groups as well. So Gretchen, that was a great question. How can we help? So I will be sending that out to all. And yeah, I will put my contact information in the chat. That is not a problem. And I see Felicia has joined us. Thank you so much, Felicia, for being here. We really appreciate it. Very busy this morning. I know you are. Before we move on to Nicole, we had a question. Did somebody get the question in the Q&A?
Larry, hi. There's a question from Jay Rossman for Tanya. Is the memorial on the grounds of Arlington National Cemetery?
Yes, it is the, as you're driving into the cemetery, it is the, I forget what they call it, the hemisphere down at the end of the boulevard. The Women's Memorial was incorporated into there. With all of the security, you know, with post 9/11 and the COVID, you now have to go through the, excuse me, you have to go through the Arlington Cemetery Visitor Center to get inside the gate to get to the memorial, but it's a short walk. It's probably about a city block or so from the visitor center down to the memorial, but it is located on the grounds of Arlington Cemetery.
Thank you, Tanya. Was Stephanie, that was it? We had the other ones answered. Okay. All right, thank you. With that being, thank you, JR, for the question. With that, we will move on to Nicole Weiss. Nicole?
I'm going to wait for you to pull up my slides and drop my contact information in the chat real quick.
Okay, not a problem.
Yeah. Oh, where'd it go? Okay. Can you go back to the beginning? Thank you. Awesome. Okay, great. Oh, there you go. There's my contact information right there. Good morning. My name is Nicole Weiss. I'm the social work case manager with the transition care management team out of Overton Brooks VA Medical Center in Shreveport, Louisiana. Like Courtney said at the beginning, we do cover Monroe area, Texarkana area, and Longview area as well. So that is what I'm here to talk to you about. Our team was formerly known as OIF, OEF, OND, and now it's transitioned into the Transition Care Management Program. Go ahead, Larry, next slide. Okay, perfect. So the first thing I wanted to bring up to any of our women veterans who are on the call this morning is that a lot of times when you go through the Transition Assistance Program or SFL TAP, you know, if you were in the Army, one thing you hear is the VA is one big thing and it's all connected. And that's not necessarily accurate. Just like how when you're in the military, you know, you have the active duty, you have the reserves, you have National Guard. In the VA, you have Veterans Benefits Administration, Veterans Health Administration, and National Cemetery Administration. They all do very different things. Veterans Benefits Administration is going to be everything relating to your money. So that's your service-connected disability, your GI Bill, your VA home loan, Veterans Group Life Insurance. Think of that basically like DFAS, because when you were in the military, DFAS is who paid you, okay? Veterans Healthcare Administration is strictly medical care and mental health care. So for those of you up north, that's Overton Brooks VA. So think of that kind of like the VA's version of a military treatment facility because they do medical and mental health care. National Cemetery Administration will of course do burials and memorials. So on the active duty side, that would probably translate to casualty affairs. So as you all know, they do very different things, and that's very important to know if you're transitioning out of the military to make sure that your contact information is updated with everybody that you speak to, because they might not necessarily have the same access to the same information. Larry, go ahead, next slide. Okay, great. So next I wanted to share about the military transition theory, which actually comes from the University of Southern California. They did a State of the American Veterans study in 2015, and they found out that there's actually 3 different stages to the military to civilian transition. In the first stage where you're approaching the transition, you have different factors like military and cultural factors would be, you know, maybe what branch you are, what was your military occupational specialty, did you have any deployments to any combat areas, or did you have any humanitarian deployments, things like that. The nature of the transition is, you know, is it an expected transition or is it an unexpected transition? Or you may be getting out of the military because you got hurt. Personal characteristics as well would be things like your health, any service-connected disabilities, and just your personal preparedness to make that transition. In the second stage where you have managing the transition, you have individual factors, which could be your beliefs, your attitudes about the transition. You have your social support, so friends, family, co-workers. You know, what if you're moving, for example, from a military town to a civilian town? They see veterans differently, you know, and they might have different resources available. The military transition management, that would be things like SFL TAP or, you know, TAP here on Barksdale Air Force Base, any of those kind of DoD transition programs. And then also community civilian transition support. Is there any support in the community? Like, for example, is your VFW active? Or is your DAV active? Or is your women veteran programs active in your community? And the final section is the assessing the transition. And you have areas like your work life, your family life, your health, your general well-being, and just being assimilated into the community. And the important thing to notice here is that failure in one area or success in one area does not necessarily mean that you failed in the transition or you succeeded in the transition, because they're all separate. Okay, Larry, go ahead and go to the next slide. All right, so how can TCM help you? TCM, I say, is like the concierge for any of our post 9/11 era veterans. Even if you separated from the military September 12th, 2001, you still technically fall under our program. And what we are here to help you do is to manage that transition. We are your primary advocate, your primary point of contact in that transition space. Even if it's been a number of years since you've gotten out of the military, because sometimes the issues that come up in transition do not come up right away. Okay, so our team here in Shreveport, we can help enroll you in VA healthcare. If all you have is your DD-214, you've never talked to the VA before, we can get you enrolled. It takes 10 minutes. Okay, we can schedule your initial primary care appointments. We can complete your individual assessment of your clinical needs or any other social needs. A lot of times I meet with people who have financial challenges in the transition, and we also provide them resources for that. For example, one of the things we also do is send a dental referral form at this stage. So if you are within 180 days out of your transition, then you may be eligible for dental care through the VA. The other way to be eligible for dental care through the VA is if you're either 100% service connected or have some kind of service connected disability. Then you also have connection to care and resources. We can provide therapy depending on the TCM team. Of course, they're all a little bit different. But here in Shreveport, we do offer cognitive processing therapy for post-traumatic stress disorder for our veterans just within the program. And a lot of them seem to like that because our schedules are a little bit more flexible and we can accommodate their schedule. The younger veterans, of course, they have kids, they have jobs, they have school, you know, they need a little bit more flexibility in scheduling their appointments. And then we have ongoing support as well. People call us with all kinds of questions or problems or issues that they have. So at the end of this presentation, I am going to drop my contact information in the chat. I would say that if you are a Louisiana women veteran, even if you are not in Shreveport or Monroe or anywhere, just text me anyway, because I can get you connected to the right person, to who you need to speak to your TCM team. I want you to really feel like you have support. Larry, go ahead and go to the next slide. Okay, and this is something fun that I just wanted to talk about. This is one of our ways that we think outside the box. A couple years ago, we had a female veteran come to us and she said, hey, you know, I need help. My kids are going back to school and right? So our team, the Transition Care Management team at Overton Brooks VA Medical Center, we envisioned and created this school supply giveaway event, which last year, this is the story that you're seeing on the slide, was its third year that we did it, where we partnered with people in the community to have school supplies, backpacks. Before COVID, we did it where we had free haircuts and free pizza and free rock climbing for them as well. But when Tanja was talking, you know, she mentioned that, you know, we need to be out in the community telling our story. And I firmly believe that, because a lot of times that is where we connect, is out in the community. So that is just one example of, you know, where our team, we saw a need and we filled it, thinking outside the box. Now at this point, if anybody has any questions, I'd love to answer anybody's questions.
Okay, we'll see if we get anything in the Q&A. But listen, Nicole, thank you so much. You know, that when you talked about even if you're not in Shreveport, you still can call, listen, that's a true statement. I have called Overton Brooks, and that transition care management team is awesome. They really are. And they will help you, whether you're in Shreveport, across the state of Louisiana, whatever the case may be. One of the biggest things that I didn't know was that, you don't have to have been deployed or necessarily injured on active duty to qualify for VA healthcare. There are other ways that you can actually do it. If you have any questions, reach out, because this is only getting bigger, because one year we'll say, well, hey, our, service members who were injured on duty need to go to the VA healthcare and go to the VA for healthcare. And then every year we kind of start opening it up because we learn more. But we only learn more when we talk about our stories more, when we talk about our symptoms, when we talk about our issues, and especially with our women veterans, very complicated. A lot of these issues when you start talking about physically. And so it's like the squeaky wheel is the one that's going to get the oil. So even if you just ask the question, call Nicole and say, hey, I'm having this issue. Can you help me out? It opens the door, which reminds me, for all veterans, with this burn pit deal, nobody's getting disability for burn pit right now at this point. But I'm almost willing to guarantee that at some point it will happen. Okay. And if you were exposed to a burn pit while you were in an austere condition, Iraq, places like that, make sure you go to the burn pit registry and sign up. Right now, it is all about gathering information. Once they connect the dots to the unfortunate sickness that comes from, or that came from exposure to burn pits, it will change. And, disability payments will be it'll just be a normal thing, because unfortunately, we had to endure that. And it was years of it. I deployed twice, and I know my first year, it was Burn Pit Central in Iraq back in 2003. So I would, whether it's burn pit or any other physical ailment that you may have, or also mental, please contact the VA. It's people like Nicole that are there, that transition team, where you can ask the question, do I qualify for VA healthcare? And oh, by the way, we'll sign you up. If you qualify, we will sign you up. So Nicole, thank you so much. I truly appreciate it. Great information. And with that, well, let's see, and no questions. So with that, we will move on to LaShondra. LaShondra?
Good morning, everyone. First, I want to say thank you all for your service, whether you're male or female. Thank you all for serving so that we could be here to serve you all. So I am the Women's Veteran Program Manager at the Alexandria Veterans Healthcare System. And as many of you have already heard this morning, that our female women are the fastest growing population in the VA. Historically, it's been a male-driven population here, but things are changing, and we are seeing more and more of our female veterans reaching out to the VA, coming here to receive their healthcare services. So as the demand increases, we have to keep up with those things and be able to give the female veterans what they need in a very dignified manner. Next slide, please. Okay, our mission is pretty much simple. It's to address the healthcare needs of our women veterans and work to ensure that timely, equitable, high quality, comprehensive healthcare services are provided, and a safe environment, a sensitive, safe environment at the VA healthcare system nationwide. We strive to be the national leader in the provision of healthcare for women, thereby raising the standard of healthcare for all women. We see that the private sector, they're definitely taking care of our female veterans. So we have to stay a step above to remain that healthcare provider of choice. Next slide, please. All right, so, how do we, how many women veterans do we care for here at the Alexandria VA? So as of FY 2020, our facility has about 3,354 women enrolled, and it has increased from 2022 as of to date. Right now, as of 2020, 2,438 are actively receiving healthcare here. And also 81% of women are assigned to a designated women's health team. Aged 18 to 44-year-old veterans comprise 43% of the healthcare users here at the Alexandria campus. Well, I say Alexandria campus, but it's a healthcare system because we do have CBOCs in different areas, and I'll get to those in a short moment. So women veterans aged 45 to 64 are many who have come through the Vietnam or Gulf War I era veterans, and that they're about 46% of our population. Women aged 65 and older make up about 12% of women here at our healthcare system. So guidelines are eligibility, pretty much 2 years active duty service, deployment in OND, OEF, OIF, and experienced military sexual trauma. Next slide, please. Okay, so how do we provide women's healthcare services? So I spoke about it in the previous slide. We have CBOCs, which are located in Fort Polk, Lafayette, Lake Charles, Natchitoches, and of course here is the main campus. We have 14 comprehensive women health PAC teams, which is comprised of a provider, a RN, a LPN, clerk, psychologist, social work, and dietitian. We also provide VA Video Connect and telehealth services and My Healthy Vet. And how do you get placed on a designated women's health team is basically you go through the sign up process through our intake, and then they ask you, would you like to be assigned to a designated women's health provider? And what differs them from another provider in the system is that they are specialized in taking care of female veterans' unique and complex needs, such as pap smears, breast exams, IVF, which is fertility problems, so certain things like that. They are specially trained in those areas to take care of you. You have a choice. You don't have to have a designated women health providers. You can go to one who is not a designated women health provider. And if those issues arise where you need that specialized care, we will contract you out. Okay, next slide. All right, so I am the Women's Veteran Program Manager, as I said, and we do have Stephanie, who's on the call in New Orleans, and Courtney in Shreveport, and we are all Women Veteran Program Managers. And whether you're in any of our catchment areas, we often communicate together to make sure that we take care of you all in a seamless manner, and so that you don't fall through the cracks. So wherever you are, we can make sure that we refer you to one another so that you get the services that you need. And so a little bit about what we do is we assist women veterans in coordinating services, whether you may need a consult outside of the VA. We are the bridge and the gap between you and your PAC team. We will reach out to your social worker and get those things scheduled for you. We will refer you to different services within the VA to make sure that you get what you need. We advocate for you all. We we look and we assess the healthcare quality and disparities in women veterans. And we create programs to make sure that we're closing in the gap between our male and our female counterparts, so that we make sure that you get the same service, and you all are my favorite, if not better service than your male counterparts. Because we know as women, we come with our complex needs, and we need a little bit more time with our providers and the service that we need. We need a little bit more time to express what we need, and we don't want to be shoveled in like cattle and say, hey, this is a blanket treatment. We know that we need that individual care. So we, as your advocate, we work hard to make sure that we're closing in those gaps, and we're giving you all what you need by equipping our providers and our colleagues with the skills that they need to be able to care for you like you need. We put on outreach programs. I know you can see in the background of Stephanie, she has a ladies' night out. I host focus groups. Courtney hosts and collaborate with people in her area to give away backpacks. We do the baby shower drives where we give our women and men who are expecting or already have their families in place. We give them things to, that babies need or toddlers need to help just ease the burden just a little bit and to show our appreciation. So when we put on these services, we definitely want to see you guys there. We definitely want to hear from you. When I put on the focus groups, I go to Lafayette. I host them here in Alexandria because we want to hear from you. We want to hear what you need. We want to keep those conversations going. Like Ms. Tanja said, tell your story. If we don't hear from you, we assume that everything is okay, and that the VA is doing a great job, and that we don't maybe need to do anything a little bit more to meet your needs. And we know that that's just not so. So we definitely want to hear from you all when we're in our outreach programs. So look for those on our websites. If you don't know that what we're having on our calendar, reach out, call us. We're going to each drop our contact information into the chat box, and feel free to reach out anytime. We're always looking for collaboration and support. We support each of our female veterans by making sure that you all have the dignity and respect that you deserve when you're coming on campus, when you're going to a non-VA provider, such as in the community. We want to support you all to make sure that you're going into those areas and you're treated with the dignity and respect that you have fought for and that you deserve. Next slide, please. So what services are available to our women veterans? We have a full comprehensive medical and mental health services here at the Alexandria Healthcare System. We promote health and disease prevention. We have primary care. We have gender-specific care, such as like the birth control, hormone replacement, breast and gynecological care, preconception care, maternity care and coordination. Now, we do not provide OBGYN services, but we do at every facility, we have a maternity care coordinator who works with you and your OBGYN specialist out in the community to make sure that you're getting what you need, that your mental health is stable, that you're not receiving any medications that you shouldn't be receiving while you're pregnant or post-care. We have our reproductive mental health. We have, and I won't go throughout the whole slide because it gets lengthy, but you kind of get the point of things that we provide here. Military sexual trauma. I do want to speak on that a little bit more because we know that our women experience military sexual trauma at a high volume. You do not have to be registered to receive mental health services for your trauma. I know our vet centers offer the services to our women who have experienced these, this trauma. So reach out. The services are there. We also have a new program called Intimate Partner Violence. I did leave it off this slide, but we do have a representative at the Alexandria location, and her name is Angela Moran. And we have piloted this program through our clinic here, and where when the woman comes in, we're asking these questions. We're assessing her home environment, her relationship status, and if her counterpart is there, her partner is there, we may ask them to step out of the room so that we can get a true picture of what's going on and be able to give them the support that they need, and refer the female to different services. So just a little caveat, we're here to help you throughout your relationship issues and process you on to a better relationship health. So moving on. Whole health. We actually offer the classes here on campus every Thursday of the month at 10 a.m. To noon. We are looking for veterans who want to what I want to say, that want to come in and help us, with this class, because veterans learn better from other veterans. Like a peer specialist. We want you to come in and teach the class. We have people to come in and teach the class, but we're looking for more. And what this is it brings you in for, the mindfulness, to, be aware of everything that you have on the exterior that, affects you inside, your surroundings, your personal development. When you come here, we don't just treat the symptom, we treat the whole person, the whole you, because we know that if your spiritual and your soul is in this duress, we know that you're in duress. So we want to help you with all those things, and know your goals and help you get there. The point of contact is Tammy Richardson and Christy Ballard. Their numbers are on the screen. So if you have any questions about whole health, please don't hesitate to reach out to us. Next slide, please. Okay, so earlier I talked about MST, which is military sexual trauma, and dignity and respect. Throughout the VA nationwide, we are putting a stop to harassment. We know that women do not come to their appointments at the VA because of cat calls and harassment and things like that. We want you all to feel comfortable with receiving your health care at a VA facility. And like I said earlier, we know that, the VA has been a male-driven facility and culture, and we want to change that. We want to move towards this being a place for everyone who's treated equally with the dignity and respect. I teach, not teach, but I educate all of our new employees that when you see a veteran in the hall, if male or female, address both of the couples with "Thank you for your services. How are you all doing today?" Because it may be that female who's the veteran, and you're addressing the male as "Thank you for your service, sir," when he's here accompanying with his wife to support his wife. So we want to thank everybody for serving, because we know whether the male served or the female served, we both served, because that person at home has to hold down the family. So we want everyone to come here and feel respected and free from harassment. It is a zero tolerance for harassment, cat calls, or anything of that nature. And we have a very great process to get those things reported and those things handled at the lowest level possible. Okay, next slide, please. Any questions? I also want to say this is Women's History Month, and I want to thank each female trailblazers such as Tanja, who has paved the way for all of us to be where we are today. And we did celebrate on March 8th, Women's Day. So again, thank you. If you have any questions, feel free to drop those in the chat box, and I will put my contact information in there as well. Thank you.
LaShondra, listen, thank you so much. That was a very informative presentation, as they all have been this morning. You know, a few things you said. One, you know, we're not treating women veterans as if they're being, you know, herded like cattle. And two, we want you to feel comfortable at the VA. You know, I love the fact that you didn't shy away from the issues that we're seeing at the VA, because we see it far too often. You know, one incident is one too many, but I like that you addressed that, because I can only imagine how many female veterans don't come to the VA because they don't feel safe. You know, they feel very uncomfortable. And, you know, it is people like you that I'm so glad that our women veterans, and look, our men veterans, because some of them are spouses, you know, may have a veteran spouse that says, no, I don't want to go to the VA. Hey, well, let me reach out to LaShondra. Let me talk to her. And also the programs that you have where you want to bring in peer support specialists, other veterans to kind of teach these classes is absolutely amazing. And that's really the purpose of this call, to get that information out there. You know, Secretary Joy Strickland, the Secretary of the Louisiana Department of Veterans Affairs, is very serious about stamping out the nonsense behavior that we have going on at some of the VAs by some people who should not be working there, with the cat calls and things of that nature. Very serious about it. And I'm glad to see that you all are very serious about it as well. Does my heart good to know that, because it's a problem that we need to alleviate, and we need to alleviate it very quickly. So LaShondra, thank you so much for saying that. And listen, thanks for all you. That's a lot of hard work. You know,
Yes, it is.
that's not easy, you know, but thank you so much for all that you do. We really appreciate it. And that is going to bring us up to our last speaker for the event. But before we get to Felicia, if you have any questions, please go ahead and post them in the Q&A now, so that we can go ahead and we can get those questions answered. If you have any questions, again, please post them in the Q&A now so we can go ahead and get them answered. Also, if you want to drop your contact information about your organization, about yourself and what you do, I see a couple of people have already done it. Paula Baldwin, thank you so much. I think Valerie Minshew, she has a great program with Woven. Too many for me to name, but listen, look back through the chat and see what's going on with the people that are actually dropping Troy as well. Thank you all so much. I couldn't get through all of the participants and the organizations that you represent in the beginning, but thank you for posting. I know it's 2 questions in the chat, and what we're gonna do is we will answer those 2 questions that are in the chat in any Q&A questions after Felicia has completed her presentation, which brings me to this. Where do you go if you have a problem at the VA? You know, there are some resources out there. But if you have an experience at the VA, or you feel like, hey, something is not right, who can you talk to? Felicia will provide that answer. You know, I met Felicia, she actually emailed me, and she was working with a veteran. And she said, hey, you know, Larry, I'm just trying to seek assistance because I'm trying to, you know, make sure I don't leave any stone unturned with trying to assist this veteran. Well, it turns out that Felicia had went to at least 7 other avenues of approach before she even got to me. And I thought to myself, listen, what do you do down there at the VA? And she said, well, I'm an experienced officer. And I said, you know, you got to explain that thing to me. Felicia does wonderful work for veterans. She can explain to you what she does a whole heck of a lot better than I can. But thank you, Felicia, for all that you do. I really appreciate it. And without further ado, Felicia Vance.
Okay, hello everyone. Let's start off with the definition of a veteran experience officer, right? So the veteran experience officer is the primary purpose. The primary purpose is to enhance the veteran experience through the timely resolution of patient and family complaints, identification and correction of the system's issue, education of staff regarding patient-centered strategies, and do data analysis and tracking to ensure we fix the part of the system that is broken. So at the VA in New Orleans, we have several veteran experience officers. We're moving from the role of patient advocacy to veteran experience officers. So what does that mean for everyone out there? We are the sounding board. We bridge the gap when you do not get the services that you need within the facility. So in our local office, we have different voluntary services that come into the facility to assist veterans. It could be from disability claims to legal issues. So we basically scatter and arrange our schedules to assist veterans timely with maybe if they have an appeal and they need to speak to a VSO, or maybe they need legal help, or they need a discharge upgrade. So there are many services that we do provide within the VA. Within our department, we started housing the VBA, Veterans Benefits Administration, because they were a little bit away from where we were located. So prior to COVID, they were in this building as well. And they will be coming back shortly by the end of this summer. So in a nutshell, we have decentralized all our veteran experience officers. So there are veteran experience officers in basically every location of the hospital. So that means that there's a patient advocate in primary care, and she works for women's health as well. We have one for specialty care. We have one for mental health. We have ones at the CBOC clinic. So they are able to assist and help with problems that may occur in the CBOC clinic. We also have like an outreach coordinator. He goes and he does family outreach in groups at some of our distant clinics, like the home of CBOC clinic. And we do have an admin casework veteran experience officer. He deals with White House congressionals, and he's the liaison for that entity. We try to catch any complaints prior to them going to the White House. And we don't just get complaints, we get compliments. And we also get care coordination issues. So it's not, everybody does not come to us because they have a complaint. It could be that the laws are changing and the systems are changing. And therefore, the veteran may not know where to go or who to go to or to find those services. And we bridge the gap. So we are the first person the veteran comes to, basically, because sometimes they don't know who to come to. So we provide that service. So we moved from the title of patient advocate to veteran experience officer, because we try to enhance your experience. So any flaws in a system or anything that, sometimes we have we have different systems and we have different services. And sometimes when we work day to day doing that particular job, sometimes or all the time, there are better ways to do things. So we try to find things that are in the system and steps that we may not have thought about as a whole system that may be able to be done different. And we do that through huddles. We do that through different high HRO models, reliability models. We do it through our lean teams. We do it through different avenues in order to take the data that we receive from the veterans and plug them into our PAT system, which is called Patient Advocacy Tracking. And we take that data and we analyze it, and we see what parts of the system that is constantly having flaws in it, or maybe hiccups. And we develop groups and lean teams so that we can better service the veterans and find ways to fix the problem. Not fix the problem for a particular veteran, but fix the problem for the system as a whole. So in fixing the problem with the system as a whole, then we fix every veteran that may encounter that particular problem. So it's not like, okay, we put a Band-Aid and fix this patient's problem. So we put the Band-Aid on, we help that patient, and then we fix the problem that is broken in the system. So basically, that is our role. We basically do everything we possibly can do. We rely heavily on the services within our facility. We are knowledgeable about each and every service within the system so that we can provide veterans with the correct information. You know, we have to follow policy, so we don't break policies, but we do find ways to tell you what the policy is and which ways you should go to explore it. We're in charge of the clinical appeals process. So we do follow the clinical appeals process. We do assist veterans in the clinical appeal process and also the caregiver support program. So in a nutshell, we are a big entity of the VA, and it is not the stigma of it's a problem or concern. We're here to enhance the experience. And if that means if we have areas that need worked on, like say if you have an area that maybe they have some rudeness complaints, we take that issue or that concern and we offer different developmental trainings for different departments, such as on the moment training. So we do those trainings and we provide that avenue so that we can train our staff to enhance the experience of every veteran that come into our facility. So basically, that's what we do. The flyers are out there. The flyers are all along the concourse course of our facility. Also, we send them out to veterans. We have a QR code on the actual flyer. We have V-signals we get data from, and we use all those different means and modalities to enhance every veteran experience every time they come into our facility. And we want to know the good and the bad. And we want to know it because that's the only way we can grow and fix problems that occur in our system. So that's about it.
Felicia, thank you so much. You know, really appreciate it. Definitely appreciate all of the hard work that you do for our veterans, especially those who are, you know, going through problems with the VA. But it's like you said, it's not just about solving one veteran's problems, but all veterans who have these issues. And, you know, you and your team work very hard down there. Really appreciate it. Now, who I need to talk to about you having to do that morning report this morning? Is that Donovan I need to give a phone call to?
Oh, yeah, Donovan.
No, I'm just messing around. No. Listen, I know you all are very busy and I really appreciate it. And thank you so much. I would be remiss if I didn't talk for 15 seconds about Tanja Miles, who she'll be okay. She just had a little medical issue last night. She let me know, but she'll be fine. She has another follow-up doctor's appointment this morning, but she was supposed to be here. But I dropped the link to Tanja, and it's more than that that's out there. You can just Google her. She does amazing, phenomenal work, and she was going to talk about mental health, especially in our women veterans. And I'm just going to read you the intro from that link, and you can go to the link and read more for yourself. But Tanja Miles, suicide survivor and recovery advocate. Tanja Miles is an ordained minister, a community activist, certified peer support specialist, veteran, and subject matter expert for community-based and systemic approaches to promote mental wellness, rehabilitation for recovery. Her expertise comes from her own lived experience as an addict, suicide survivor, and victim of childhood sexual abuse. She is an advocate for humane, compassionate, and ethical treatment of individuals who suffer from mental illness. And if you have never heard Tanja speak, I'm telling you, it is amazing, and you will never forget her words as they come across to you. She is very intelligent, very smart, and a big time women veteran advocate. And we are lucky to have her here in the state of Louisiana. So you can read more about Tanja. And with that being said, we're going to get ready to close. But here's two things I know. One, oh, you guys already closed out the question. So nothing in the Q&A. I see. Okay, there you go. So I'm going to go back through the chat unless Courtney, you already have the questions queued up. If not, Zena posted in the chat, and this is for anybody who's ready to answer the question, or if you have a good beat on the answer. What media is used to relay the various events? I'm in Lafayette, have not heard anything. Thank you.
Larry, here in Shreveport, the Overton Brooks VA Medical Center, we partner with our public affairs a lot. So if we do any TCM related events, we will share it with the public affairs, and they'll put it on their Facebook page. So anybody wants to follow Overton Brooks VA Medical Center Facebook, that'll be good.
Yeah, sounds good. And that's why I would start, Zena, with that public affairs section for each one of the VAs. And, other social media is real big now. I think you all have Facebook pages, but also everybody who's on the call, you can send them an email, and I'm quite sure that they can point you in the right direction. But yeah, the public affairs, I strongly suggest as well. Are there any group counseling sessions for women only?
Shreveport has Veteran Hope events as well. I'm not sure though if they are virtual. Whoever had that question, if you want to email me or call me, I will find out that information and get back to you. But Veteran Hope is a women veteran only group.
Alexandria had a sister to sister women's only group. I'm not sure if it's still up and running. I do know the psychologist who was doing that move, but if you would like more information, please reach out to me and I'll find that out for you.
Sounds good. Thank you, ladies. Oh, I'm sorry. We got another answer. Okay. So J.R. Rossman is a female vet, not in Louisiana. She's in the DC, Maryland area, waiting to go through VA Health and apply for e-benefits due to COVID. And I'm not sure. Okay, no, she was just explaining. Okay, got you, J.R. Are there brochures or info published listing all women veteran services available? I do not think there are, but I could be wrong. Is this a matter of going through each of the hospitals listing of what's available and kind of compiling your own list, or is there something out there, ladies?
I know that, I'm sorry. I know that on my website for the Alexandria VA, when you go to women veterans, it takes you to a page, and it has the list of services that we provide. And it also has my contact number on there, because if it hasn't been updated and it's something that you may think of and you don't see it on the list, we may provide it, it just hadn't been updated. So just give me a call or an email.
Okay.
Same for me in New Orleans.
Okay,
I sent my information to Larry that has all of the specific services that are offered in-house and then through care in the community. So sometimes when the services aren't able to be provided at your local VA, there's something called Care in the Community, and you can be seen for that service off-site, and then the VA pays for those services. So if you have any questions about Shreveport services, they're in there. I did put in the chat the closest thing that would give you information about the services available to women veterans, just in a broad sense, would be under that womenshealth.va.gov. And then if you contact any of us or call that 1-800 number, they will get you linked up with our counterparts are all over the VA and in Manila and the Virgin Islands, Alaska, all 50 states. So, you know, we're all over the place. And if you need help, just reach out and we'll get you plugged in with the right folks.
Sounds
There's,
good.
there was one question we wanted to put to the panelists. I'm not sure if you all had seen it. It was about, I'm gonna scroll up here. It was about some specific focus groups for vets who are looking, who are having some employment concerns. And, you know, Stephanie and I were messaging offline. I'm not sure of one that is specific to employment, but I know they mentioned the Women's Hope group. They're very supportive of one another, respective of whatever you know you're having a concern with. There's also our vet centers are great. They might have some resources, and some of them run women-only groups. So hopefully that helps. And again, if there's a specific thing you're looking for, please don't hesitate to reach out. That there's so many resources, and if we don't know the answer, we'll get you plugged in with somebody who does.
Courtney, I think I saw in the chat somebody may have been from the Louisiana Workforce Commission. I think there's two representatives that work specifically with veterans. Again, whoever had that question, if you just want to email me or text me, I will find out who those people are and get back to you, because I don't remember their names off the top of my head.
So we have two left. Two. And I would encourage everybody, as we starting to wrap up here, the panelists undoubtedly have busy days. They posted their contact information inside of the chat. You may have to scroll up to find it, but you can always email them and ask some questions. You can also save the chat, but we'll get to the last two questions. With the growing population of women veterans, what outreach efforts nationwide are in place to get them enrolled in using VA services?
So the short answer to that would be each of us does our own outreach. And so nationally, I would say one of the big things that they've done is set up that 800 number that's just for women veterans, right? I've put that in the chat and I can put that in there again. There have been a number of campaigns. They're internal, right? But nationally, they're pushed out to all the VAs. LaShondra talked about it in her presentation about culture change. We just finished one that was I'm Not Invisible. That was a huge internal campaign where we put up big, giant posters of female veterans and a little snippet about who they were and what their service was. So there's a lot of initiatives going on, but maybe, and I know in other places they've even had funding for billboards. So I hope that helps. We're doing our best. This is a good outreach event. Things like this will keep going on. There's an event this Sunday up in this area of the state where we'll do more outreach. We'll have specific information for our women veterans. We'll even have enrollment specialists on site to get people enrolled in VA healthcare. And I think there's going to be some people from the benefits section to help folks file claims.
Also, in response to that question, the Center for Women Veterans, the Trailblazer program, part of what that is not only to honor and recognize women veterans who are, you know, out there supporting the community. But one of the things that they have asked the 2019 and 2021 Trailblazers to do is to be an advocate out in their communities, to, you know, push, or not push, but to help, you know, bring women into the VA, you know, to kind of act as ambassadors for not only the Center for Women Veterans, but for the Veterans Administration, to let women know that, you know, they need to be enrolling, you know, getting their benefits, you know, and they're like, you know, like we've said all along, you know, there's a lot of benefits out there for veterans, period, but specifically for getting women veterans in there so that we can, you know, receive the benefits that we work and we've earned. So that's part of the Center for Women Veterans push to get these resources out nationwide.
Got it. Thank you. And
There,
last, yeah,
I'm sorry to interrupt, Larry. There was another question in the chat box.
yeah.
Are there any studies out there on what military service does to women physical health? I have seen studies on what the physical wear of military service on a man's body in comparison to a civilian's body. I have not found any about women's body. I can speak to that a little bit maybe, but does anyone else want to speak to that? Okay, so we do know that it is very different what happens to a woman's body than a man's body. I think there is a push nationally. I don't think it'll be quick to make adjustments in the gear for women veterans, because we do know that they have more musculoskeletal issues related to their service, related to their gear, than male veterans do. It is one of the most common health complaint that our women veterans will experience in VA care. So I don't have a specific study to cite or refer anyone to. It is known, at least to us healthcare providers, that this is the case, and we work. I think we all are working hard to address that the best that we can for our women. Most of our VAs have incredible physical medicine rehab services that encompass not just orthopedic surgery option, but lots of physical therapy, chiropractic care, acupuncture, all kinds of wonderful treatments to help with the musculoskeletal issues.
Thank you, Stephanie. And with that, we will go ahead and wrap up. And, you know, I want to say, listen, thank you so much to our female veterans, not just those who participated today, but also our panelists as well. And also our female veteran supporters. I truly appreciate it. You know, it is a special place in history for you all. But, you know, as Tanja said earlier, you know, we continue to write that history. We continue to make those opportunities and take advantage of the different things that are out there for our women veterans. But also, you know, the support has to continue to be there. And I can't thank you ladies enough for everything that you do in that space. It is absolutely amazing. And thank you for taking the time out of your busy schedules to be here with us today and provide us with so much information. Now, listen, the emails and phone calls probably going to start rolling in, you know, but I can't tell you how much we appreciate the transparency of everything. Tanja, Lysandra, Stephanie, Courtney, Felicia, Nicole, and unfortunately, Tanja couldn't be here with us, but thank you all. I truly appreciate it. And hopefully we can see you again next year. Thank you so much.